Well, maybe let's start now. And I would like to welcome everyone around the world. And I'm very happy that you joined this webinar. We are having here in collaboration with the Humanity and Inclusion and the Global Rehabilitation Alliance, which is meant to support advocacy on a WHO resolution on rehabilitation. But maybe before we start that, we have to, well, have a short thinking about the situation, the global situation we have with the corona epidemic or pandemic, which is really stressing us a lot. And I think most of you will be in this stressful situation, because especially in the health sector, we really have to decide many things, how to do that. And of course, this well has some impact also on our activities toward advocating rehabilitation. But we should keep the momentum we have, and you will see from the presentations today that there are many things already happening, and we have a lot of progress. And we should use also the time, if we are in home office or whatever, to work on this. So let's keep our spirit, but every one of you, especially on your, well, personally and for your families, I wish good health, that not too many things happen. And we know the situation in many countries is very bad. And we hope this can be overcome. But it is the first time we experience that, and we need to deal with that. And we know how stressful this is. So good health for everyone. I would not forget this, and for your families and also for your countries. But now I think we should start with our meeting. And where, if you go maybe back one slide back, please, the agenda slide. This one, yes. And we have three parts of this webinar. The one is to give you the background and an update on activities that already has been done, especially for advocacy activities towards the WHO resolution. Then Valentina is going to show you more details about the toolkit that has been developed, and it is very useful, I think, because we have to start also working at the national level, and of course we will have the questions and answers. My proposal is that we have a short introduction. Who's on the web today, yes, and who's here in the webinar room. So everyone, please give a short, tell us your name and your position, that we know who's here.
So maybe I can start from me. I am Boyan Graha. I'm the Secretariat from Global Rehabilitation Alliance, based in Hanover, actually. Nice to see you all. So next, please.
Yes, hi, my name is Vanessa Seijas. I'm representing the International Society of Physical and Rehabilitation Medicine. I'm the secretary of the WHO Liaison Committee, and I'm based in France right now.
Good morning, everyone. Pierre Cote from Canada. I'm a member of the executive of the Global Rehabilitation Alliance.
Hello, everybody. I'm representing International Council of Nurses. My name is Alessandro, and I'm based in Geneva right now.
David Constantine, founder director of Motivation and executive board member.
Hi, I'm Lemmy McNeely with the American Speech Language Hearing Association, and I am in Maryland.
I'm Brooke Hallowell. I'm also with the American Speech Language Hearing Association, and I am in the US, in Massachusetts.
Hello, I'm Cathy. I'm a technical unit manager for Humanity and Inclusion based in Togo.
Hello, I'm Blandine Bugnol from Humanity and Inclusion, working closely with Valentina.
Hello, I'm Patrick Lefel-Calvez, a technical advisor for rehabilitation for Humanity and Inclusion, based in France.
Any other person who would like to introduce?
That's also very happy that we have a great diversity from many organizations. That's very good because we need the collaboration of all the organizations. Now I have to ask, Boya, are you going to give the update, or is it okay, or should I? We cannot hear.
I think it will be better you, because everyone who would like to join this webinar should I need to give permission.
Okay, okay. So I will give the introduction, the background, and update on activities, and then to introduce myself. I'm Christoph Gutenbrunner. I'm president of the Global Rehabilitation Alliance, and of course, Valentina will introduce herself in the second part. But maybe we can do this then. So please, the next slide. What are the activities, or what is the background? Next slide, please, where we all come from. And I think it is good to repeat this briefly, but there's, I think, not much discussion, because this is already the common ground we had when we are founding the Global Rehabilitation Alliance. And we know from the World Report on Disability and also other studies that have been done after that, that there is an unmet need of rehabilitation in many countries and many world areas, of course, in particular in the low and lower middle income countries, but also in the high income countries. The problem still is not solved, and we know that the demand for rehabilitation service is still increasing year by year, or we can say month by month. On the one hand, of course, we have an increasing number of persons living with disabilities, but we also have the aspect of chronic health conditions. We have the survival rates, and we have the aging populations, that are all factors that make the need of rehabilitation higher. And there's one thing I always like to add to this one, even in situations after infectious diseases, the need for rehabilitation is increasing as well. We saw this from the Ebola, but also from the Zika, and let's see what will be the outcome of the Corona. We agree with WHO and also with many other bodies that rehabilitation is part of the continuum of care, and it is part of universal health coverage. So there is a commitment that rehabilitation should be provided for persons who are in need. And the last point on this slide says that we, as civil society organizations, also have a responsibility to support this. We cannot leave this just to the governments, so we have to raise our voice. And the next next slide, please, is about why, or what is the role of a resolution of the World Health Assembly. Of course, the resolutions are non-binding instruments, but they are very strong instruments, very strong commitments, because all the countries that voted there in favor of such a resolution commit themselves and adopt this kind of resolution. So we use it also in the country to promote for the rehabilitation. If we are aiming at a resolution on rehabilitation, we have to be aware what our resolutions have been adopted previously, and maybe many of you will remember that there was a resolution in 2005 called Disability, including Prevention, Management and Rehabilitation. So this was connected disability and rehabilitation, and you're also aware that there was another resolution in the World Health Assembly in 2013 called Disability. In this resolution, of course, rehabilitation was one of the points, because they said for persons with disability, we need the access to rehabilitation, but the focus was mainly on disability. And sometimes if we use this is a very important perspective, but this is only one perspective, because we have chronic diseases and others, as I mentioned before. Then last year, last year, we had the resolution on assistive technology, which was a very important step forward, but we have to be aware that this is only part of the rehabilitation, and we have sometimes the issue, especially at the WHO level, that assistive technology and rehabilitation has been as some separate topics or 7 initiatives. And of course, one very supportive part of it, and this was the origin of the Global Rehabilitation Alliance, is the WHO initiative Rehab 2030, a call for action. And in this initiative, next slide, please, there was agreement on the concept note. This is only some parts of it for sure, but we need to be short. We agree, we have common sense that rehabilitation is essential for healthcare for persons experiencing disability. We know that the number of persons living with non-communicable diseases, chronic conditions is increasing, as well as the number of persons living with disability. We know that rehabilitation can reduce costs, but also enable persons towards participation and better functioning. We agree, I mentioned this before, that rehab should be integrated in the health system, and we need